We all are aware of the increase in number of cases, COVID-19 cases have been detected and reported recently. Yesterday, the Ministry of Health reported 187 cases of locally transmitted COVID-19 infection. Today, that number is 216 locally transmitted cases out of a total of 219 cases that we're reporting. And based on the confirmed cases as of the 2nd of September, there were 528 patients admitted in our acute care hospitals, of which 5 patients were in the ICU. And all these ICU patients were either unvaccinated or only partially vaccinated. An additional 27 patients in our general wards required oxygen supplementation. The majority of them, about 80% of them, were cared for in our public hospitals, while the remaining 20% of cases were admitted in our private hospitals. And we have seen 885 cases yesterday cared for in our community care facilities. The increasing number of cases will naturally raise concerns among members of the public who are concerned that the COVID-19 situation may be deteriorating. The rise in the number of COVID-19 cases in the community is not unexpected. We have moved away from the restrictions imposed under Phase 2 Heightened Alert, and there are more people leaving their homes now on a daily basis for work or for social activities. Groups of up to 5 people may now gather for meals and social gatherings. So the opportunity for close, mask-off physical interactions is now increased. Phase 2 Heightened Alert was not imposed with the intention to simply suppress COVID-19 infection to the extent that we would eradicate all such infection in the community. The measures introduced reduced close contact encounters sufficiently to ensure that the number of new cases that emerged were sufficiently suppressed so that the demand for hospital isolation beds and ICU beds could well be met by the available resources that we had in our healthcare system, while allowing our vaccination campaign to proceed so as to achieve a high enough vaccination coverage in our population. And these measures have been successful so that our healthcare system was not overly burdened, and we have previously announced that that we've achieved a very high vaccination coverage rate. As of the 2nd of September, 80% of our total vaccination resident population has received the full 2 doses. And this means that, that we have greater confidence now with such a high vaccination rate that we can move on in our transition eventually towards an endemic phase. Being fully vaccinated doesn't mean that those who are vaccinated would never get infected with COVID-19. But what it means is that vaccination reduces your risk of getting infected if exposed, and it reduces your risk of getting a severe COVID-19 infection. Vaccination means that your chances of needing ICU care or even dying is greatly reduced. And indeed, over the last 28 days, the percentage of those who are unvaccinated and who became severely ill or died was 9.2%, while those who were fully vaccinated but then became ill was 1.3%. And this is a 7-fold reduction in severely infected or death rates, a stark difference which actually demonstrates the protective benefits that vaccination provides. So even though the number of community cases has increased, there has not been a significant surge in the number of cases which requires intensive care. Our ICU admissions have held relatively steady. Last week, we had about 6 to 7 ICU cases. This week, in the past few days, we've had 5 cases in the ICU and no new admissions in the ICU since the 21st of August. So even though the total number of local cases has increased from an average of 58 cases a day in the week before to 132 cases per day in the past week, that ICU numbers have not increased correspondingly. The clusters of cases in the Bugis Mall and the bus interchanges have involved individuals who are relatively young or did not have risk factors for worse outcome. Many of these individuals were also vaccinated, and so they too derived the protective benefit of being vaccinated. Over 98% of individuals who were infected were either well, without any symptoms, or mildly symptomatic, with at most minor respiratory symptoms. And we expect them to recover without much need for further medical care. Nonetheless, we monitor them very closely to make sure we provide them with the appropriate treatment for their clinical needs.